and friends, I am Dr. Anil Ballani, consultant physician, proudly attached to Lilavati Hospital right from its inception. I have been associated with this hospital right from day one, and we proud to say that the first patient admitted in this hospital was mine. It has been great working in this hospital, and my special interest is in hypertension. As we all know, hypertension is a major issue, major illness. It being one of the most commonest illnesses, the prevalence being almost 30%. So just to give you an idea, out of every 10 people in the room, 3 people are hypertensive. As we all know, hypertension is the third most important risk factor for a disease burden across the country. It is the most important cause of stroke deaths, almost 57%, and 25% of the coronary heart disease. And the incidence of hypertension in urban areas is more as compared to the rural areas. We have almost 33% in the urban areas as compared to 27% in the rural areas. The unfortunate part is that only about 25 to 30% of our hypertensive patients are under control. So it's a very, very sad part that in spite of being in a city like Bombay, only 30% of our hypertensive are under good control and who will not have long-term complications. So this is one field where I excel, and I make it a point to check the blood pressure of every patient who comes into my consulting room, whether it is for fever, whether he's a diabetic, whether it's an asthmatic. That's the way to screen most of our patients. And we should not take hypertension lightly, because as we all know, it doesn't produce any symptoms. And that is why we call hypertension as a silent killer. Most of our patients unfortunately come to us very late in their course of hypertension. By the time already heart disease has developed, kidney failure has developed, or the patient presents with a stroke leading to paralysis. So these are some of the dreaded complications of hypertension affecting the brain, the heart, and the kidney. So hypertension becomes a multi-speciality disease where sometimes we have to rope in our nephrologist colleague where there is renal involvement, creatinine has gone up. Sometimes we have to rope in our cardiologist colleague to do a coronary angio, as patients develop coronary artery disease very commonly in hypertension. Not only blood pressure, we also have to check the lipids, whether the LDL cholesterol is under control or triglycerides are high, and then give the medicines accordingly. So this is how we strive, and we do a comprehensive management of hypertension at Lilavati Hospital. Thank you.